Then Epididymo-Orchitis. Basically, that is infection. If you look at epididymo, so infection of the epididymis, and also orchitis is infection or inflammation of the testis. So if you talk of epididymo-orchitis, so inflammation, rarely does it just affect the testis alone. So that will be orchitis. It tends to affect both. Yeah, so it's usually an acute inflammation. It may result from viral infection, for example, mumps. So if children, for example, develop mumps, that in itself can actually cause inflammation and cause epididymo-orchitis. Yeah, and then also in syphilis. Thankfully, syphilis nowadays, of course, is a sexually transmitted infection, but it's rare. It's a bacteria caused by bacteria. So in the site of, it can be a site of guma in tertiary stage of syphilis. So syphilis have a primary stage, we have secondary stage, and then we have tertiary. That is the last stage. So it comes with a complications and masses that can be within the epididymis or even the testis. So it can be affected by syphilis in the tertiary stage. So usually most of this epididymo-orchitis is associated with lower urinary tract infection and or surgical instrumentation. So you can have both infection and surgical instrumentation. So when you do instrumentation, that is, for example, you do catheterization for long, that in itself can cause infection, and that can descend through the vas deferens, can go all the way to the epididymis and even to the testis. So that is what most of the time, and sometimes, of course, is sexually transmitted infection that goes down through the vas deferens all the way to the epididymis and the testis. So you end up with epididymo-orchitis. So it can also be a site of disseminated tuberculosis infection. Tuberculous, so you can call it tuberculous epididymitis, or you can call them tuberculous orchitis. Personally, I've operated on a man, I think was in mid-30s, who had a lot of pain in the testis for long, swelling. So finally, when I operated, I found the testis completely destroyed in one of the testes. So I had to remove it. And then when I did send it for histology, finally it came back as positive for tuberculosis. So that was tuberculous orchitis. So we said tuberculosis last time when we discussed tuberculosis, we said there's what we call extrapulmonary tuberculosis that can affect any part of our bodies, including bone, including testes. Any part of the body can be affected by tuberculosis. Thankfully, in the time in which we live, because of the proper management, diagnosis, and treatment of TB, tuberculosis, it becomes a bit rare. However, it's still there because the patient that I was talking about just some 2 years ago when I did diagnose that patient with tuberculous orchitis.